The People's Hospital, Hope and Peril in American Medicine by Ricardo Nuila offers an in-depth look into the American healthcare system. Nuila explores the experiences of patients and healthcare providers, highlighting both the strengths and the significant challenges faced by the system. Through real-life stories and detailed analysis, the book sheds light on what works well and what needs improvement in American medicine. Chapter 1. The Promise of Healthcare. Nuila begins by discussing the fundamental ideals of healthcare. He explains how healthcare is meant to provide healing and support to everyone. The chapter sets the stage by outlining the ethical responsibilities of healthcare providers and the expectations of patients. Chapter 2. The Human Side of Medicine. This chapter focuses on personal stories from both patients and doctors. Nuila illustrates how the relationships between them can deeply affect the outcomes of treatments. The emotional and psychological aspects of healthcare are emphasized, showing the importance of empathy and understanding. Chapter 3. Systemic Challenges. Nuila examines the structural problems within the American healthcare system. He talks about bureaucracy, inefficiency, and the high costs of care. These issues often lead to frustration for patients and can result in inadequate treatment. Chapter 4. Patient Safety. Patient safety is the main topic here. Nuila discusses common medical errors and their serious consequences. He highlights the need for better safety protocols and greater accountability in hospitals to protect patients. Chapter 5. Technology and Healthcare. This chapter explores the role of technology in modern medicine. Nuila looks at how advancements can improve diagnostics and treatments, but also points out the challenges they can bring, such as increased complexity and potential for errors. Chapter 6. The Role of Communication. Effective communication is crucial in healthcare. Nuila shares instances where poor communication led to misunderstandings and compromised patient care. He stresses the importance of clear and accurate information exchange between healthcare providers and patients. Chapter 7. Healthcare Professionals Under Pressure. Nuila sheds light on the immense pressures faced by doctors, nurses, and other healthcare workers. He discusses issues like burnout and stress, explaining how these factors can negatively impact the quality of care provided. Chapter 8. Access to Care, Access to Quality. Healthcare is not equal for everyone. This chapter examines the disparities based on socioeconomic status, race, and geography. Nuila shows how these inequalities affect patient outcomes and access to necessary treatments. Chapter 9. Insurance and Healthcare Costs. The complexities of health insurance and the high costs of medical care are major barriers for many patients. Nuila analyzes how insurance policies and expenses influence healthcare decisions and limit access to care for some individuals. Chapter 10. Mental Health Services. Mental health is a critical part of overall well-being, yet it is often neglected in the healthcare system. Nuila discusses the stigma surrounding mental health and the lack of resources available, which hinder effective mental health care. Chapter 11. Chronic Disease Management. Managing chronic diseases requires ongoing care and resources. This chapter explores the challenges patients face in handling long-term conditions and the support they need to maintain their health. Chapter 12. Preventive Care. Preventive measures can greatly reduce the incidence of serious health issues. Nuila emphasizes the importance of preventive care and early intervention, advocating for regular screenings and healthy lifestyle choices. Chapter 13. Innovation and Research. Advancements in medical research and innovation hold the promise of better treatments and cures. Nuila highlights the importance of continued investment in medical research to drive progress and improve healthcare outcomes. Chapter 14. Policy and Healthcare Reform. Nuila discusses the need for comprehensive healthcare reform to address the system's flaws. He reviews various policy proposals and their potential impact on improving the healthcare landscape in America. Chapter 15. The Future of American Medicine. Looking ahead, Nuila envisions a future where the American healthcare system can overcome its current challenges through collaboration, innovation, and a renewed commitment to patient-centered care. He offers a hopeful perspective on the potential for positive change. That's it. Thank you so much for tuning in.